is Dr. Laura Diaz, and welcome to my treatment group for schizophrenia and psychotic disorders. My client's name is Tamra, Holland, and she's 50 years old. The differential diagnosis is delusional disorder, erotomanic type. The primary diagnostic features are a person with this disorder experiences delusions for at least 1 month, and no other schizophrenia-like symptoms are present. So, a little bit about my client. She's 50 years old and she works at a local coffee shop as a barista. She claims to be passionately in love with one of her regular customers. She hasn't said anything to him because she believes that he is married, but seeing him every day has become increasingly difficult, and she is now considering quitting her job, even though she desperately needs it because she's living paycheck to paycheck. She believes that he's in love with her too, and she makes that belief based on the fact that he makes casual conversations with her, and she says that he's made suggestive movements towards her. She believes that he wants to declare his feelings for her, but he has a high moral standard and would never betray his wife. So when she was asked, for some examples of what the casual remarks and witty banter consisted of, she said that there was this one time where she made a pretty leaf pattern on his coffee, and he made the comment of, "Those kind of special touches are what keep me coming to this coffee place. I really appreciate it. Thanks for making my day." She remembers the smile on his face and claimed that when she handed him the coffee, he brushed her hand ever so slightly, and she states that the touch is all she can think about. "I live for that brief touch, even each and every day when I hand him this coffee." She goes ahead and tears up and says that the pain of unexpressed love is just too much, and she can't take it anymore. And Tamra indicates that it has been going on for nearly 2 years now. And in the beginning, it was just a little diversion in her day. But eventually, over time, the feelings started getting stronger and stronger. She would look forward to walking into the store and talking to him, but now the visits have become pure torture. She states that she started losing weight and she feels nauseous whenever she thinks about him, and she thinks about him a lot. Her sleep has also been affected. She tosses and turns all night. So a little bit of her childhood, she was raised by a single mother. Until the age of 5, her mother remarried, and her stepfather was very strict and had very high expectations of her. She had difficulty in school, and that was due to her intelligence issues. Her teachers told her she was a very slow learner. So she struggled a lot in school and with the criticism from her father. She became chronically anxious and fearful, and she had difficulty feeling comfortable in social situations. She was married once before, but is now divorced because her husband is also highly critical, and she claims that the marriage was asexual, so there was no children ever. She never had any children. On the assessment, Tamra exhibits simplistic and sometimes childish thinking, and she has reached now levels of chronic feelings and sadness that disrupted her ability to sleep and eat. So for axis 1, it's delusional disorder, erotomanic type. For axis 2, none. Axis 3, none. Axis 4, none. Axis 5, 65. And for the theoretical perspectives, for biological perspective, this client's psychotic symptoms may be due to an imbalance in neurotransmitters. And excesses of dopamine has been found to be associated with delusions. So whenever the client thinks about her forbidden love or seeing him, when she makes his coffee, the dopamine is secreted, causing the idea of forbidden love. Cognitive perspective, this client's symptoms have resulted from a distortion in perception. She clearly has the tendency to misinterpret insignificant environmental stimuli as significant. Distortion has resulted in the erroneous belief that another person feels in love with her, and when in reality they do not. Behavioral perspective, this client's symptoms may be due to the faulty learning experience. This client has been operantly conditioned Each time she experiences being in love, it feels highly pleasurable, which is positively reinforcing. Thank you.